British Columbia marks 10 years since declaring a public health emergency on April 14, 2016, with more than 18,000 people dead from toxic illicit drugs during the decade-long crisis. Fentanyl, introduced into the drug supply, catalyzed the crisis, with synthetic opioids prevalent in deaths soaring from 29% in 2015 to 66% in 2016. For more on this, listen here.
10 years after British Columbia declared a public health emergency over toxic drugs, the province is still losing close to 5 people every day and has now surpassed 18,000 deaths. In an information bulletin released March 12, 2026, the BC Coroners Service said that while January's 150 deaths represented a 10% dip from January 2025, the toll still equaled 4.8 lives lost each day, consistent with the number of deaths reported monthly throughout 2025. The cumulative count is staggering. A February 2026 update reported 1,826 lives lost to unregulated drug toxicity in 2025 alone, a 21% decline from 2024, but still the first time since 2020 that the annual total fell below 2,000. More broadly, the Coroner Service notes that since the emergency was first declared in April 2016, the lives of at least 16,047 people in BC have been lost to unregulated drug toxicity, and with another year of deaths, the total now exceeds 18,000. Preliminary data for 2024 put that year's toll at 2,253, and the first half of 2024 saw 1,158 deaths, about 6 per day. The toxic supply remains the driver. Fentanyl and its analogs were detected in roughly 8 of every 10 expedited toxicology tests in January 2026, and smoking is now the dominant mode of consumption. Evidence indicated that almost 3 of every 4 decedents in January 2026 consumed the substances that killed them by smoking. By health authority, Fraser and Vancouver Coastal accounted for more than half of January's deaths, while Northern Health posted the highest rate, 58 deaths per 100,000, followed by Interior Health, 40 per 100,000. Demographics have stayed grimly consistent. About 7 in 10 decedents are between 30 and 59, and roughly 3/4 are male, though the rate among females has risen sharply since 2020. The crisis remains the leading cause of death in BC for people aged 10 to 59, outpacing homicides, suicides, accidents, and natural disease combined.